A life that is one unending night. A life without vision or sight. Refractive error, long or short-sightedness, has been identified as the second largest leading cause for preventable blindness by the World Health Organization. India has a population of 1.27 billion. Around 15 million people are blind. One-third of the poorest people live in India. Eye health is a significant cause of poverty, affecting income and livelihood. 80% of blindness is avoidable. Sightsavers has been working relentlessly for 60 years to eliminate avoidable blindness and to promote equality of opportunity for disabled people. In India, Sightsavers works in 18 states in partnership with over 105 organizations. Mumbai Eye Care campaign is a Sightsavers initiative with the goal of working towards raising eye health awareness amongst the population of Mumbai. Mumbai Eye Care campaign was initiated in April 2009 with the financial support from Standard Chartered Bank under their Seeing is Believing program.
Standard Chartered Bank's flagship community investment program, which looks at preventive blindness, launched in 2003. It came out as an idea from a staff, and today it's become a huge investment program for the bank. Corporates today also realize their corporate responsibility. They're not being forced into doing anything. They want to help the communities.
Mumbai is India's financial, commercial, industrial and entertainment capital, with a population of about 12 million citizens. Unfortunately, of this, 10 million citizens live in the slums. The 5-year Mumbai Eye Care campaign will target those living in the slums of Mumbai, particularly the most vulnerable groups such as women and the floating population. MECC's approach to reach the slums and other vulnerable communities include working with community-based organizations for community mobilization, people's participation, and building the sustainability of the program. The clinical and medical services are provided by the partner organizations that run eye care hospitals.
We used public awareness system. We used methods like pamphlet distribution. We also used methods like radio, and all these things has created like huge awareness. As a result, millions of people were screened. So if you look at today, after almost 5 years, the project among the community, among the slum dwellers, even general public, people know clearly what is the need for eye care. According to our current strategy, we are thinking, or we have already designed an urban eye care framework, which is completely in line with the National Urban Health Mission and government programs. So there is a complete partnership or linkage with the government program, which is sustainable.
A pilot study in 2009 reflected the huge need for primary eye care in Mumbai, especially for refractive error services. In order to meet the huge need for primary eye care services, 15 vision centers were established in the community. Besides these 15 centers, the project also has a mobile van to cater to the floating population.
The protocol is a very comprehensive protocol where we screen for all leading causes of blindness, beginning with uncorrected refractive errors, glaucoma, diabetic retinopathy, cataract. We also do corneal issues and neurological problems.
Having access to quality eye care services at their doorstep and spectacles at nominal prices helps safeguard the livelihood of many cottage industry workers who rely on their vision for nearsighted work.
Last 4.5 years, been associated with Sightsavers for a new project called Mumbai Eye Care campaign. Each vision center has got field workers who go into the house and screen the patients for any defect in the eye. And those people who are found with defect, they are brought to the vision centers for further examination, where most of the refractive errors are cured and they are given a pair of glasses. And we also perform sight restoring surgeries here free of cost.
As the project grew and progressed over the last few years, a component of sustainability has also been built in. In the year 2012, nominal spectacle charges were introduced at the centers.
When MECC started, we started on a charitable or a free mode. However, as time progressed, we started looking into the economic viability of these centers in terms of sustainability or making the centers more sustainable.
Daniel Fonseca runs a public phone booth in Mankod, traveling every day from his home at Trombay. When Daniel's vision started to blur, life became more of a challenge. He went to Mumbai Eye Care Vision Centre at Trombay for a screening where they detected cataract in his eyes. After a successful surgery at the referral hospital, Daniel now wears spectacles which helps him manage his work and life with ease.
जी मेरा चेकअप MECC ट्रॉम्बे विजिट सेंटर में हुआ था और मुझे बताया कि वे ऑपरेशन करना पड़ेगा, तो इसी वजह से मैं बच्चों वाले हॉस्पिटल गया। वहाँ पे भी मेरा चेकअप हुआ। उसके बाद में वहाँ पे ऑपरेशन होने के बाद प्रैक्टिकल लगाया मैंने चश्मा, तो अभी पहले से ठीक दिख रहा है मुझे।
म्हणजे एक वेळ अशी होती की आम्हाला सांगावं लागायचं, आज लोक आमच्याकडे येतात आणि आम्हाला सांगतात आम्हाला मोतीबिंदू झाला, आम्हाला कमी दिसतं, तर हा फरक खूप खूप मोठा आहे आमच्यासाठी आणि त्याच्यासाठी धन्यवाद की साइट सेवर, मुंबई आय केअर कॅम्पेन आणि आमचं हॉस्पिटल.
A 43-year-old homemaker Yashoda suffered from frequent headaches and had difficulty reading. Even day-to-day work was hampered. During door-to-door visit, a health worker from Mumbai Eye Care campaign met Yashoda and advised her to visit the nearest vision centers to get her eyes screened. At the vision center, spectacles were prescribed and given to Yashoda. She was finally relieved from the constant headaches. She got her ray of life back.
मग तिथे आले, चेक केल्यावर मग नंबर आहे बोलले चष्मेचा, मग नंबर दिला, मग चष्मा आणला मी, मग ते वापरायला लागल्यावर मला दिसायला लागला आणि व्यवस्थित काम करू.
Besides service delivery, a very unique feature and objective of Mumbai Eye Care campaign has also been to spread awareness about the potentialities of the blind and create an environment whereby the blind and the visually impaired will be accepted in the society with full rights.
Sightsavers has also provided its own set of expertise and, most important, the financial support to help the XRCVC attain its dream and goal of building a more inclusive society in India.
Number of people screened 1.23 million. Number of people refracted through vision centers 0.18 million. Number of spectacles dispensed 0.10 million. Number of people reached with IEC materials 10.88 million.
In the community, there is still a huge aspiration, there is huge need for quality services. And as the punchline of Mumbai Eye Care campaign goes, Mumbai dekhega to India badhega, I think that really holds true.
Thanks to Sight Saver.
Helen Keller said, "There is no better way to thank God for your sight than by giving a helping hand to someone in the dark." The Sightsavers' efforts find an echoing in these words of Helen Keller.